Hi, and welcome to the session number 5 in Saskatchewan Health Authority's prenatal education sessions. My name is Janice Bennett, and I'm a registered nurse and a prenatal educator. Put my screen back on here. So welcome. This is the 5th in the series. Again, acknowledging all the pictures are either free or with permission. So today we're going to talk about right after baby, right after the birth, and your hospital stay. Baby's going to go skin to skin with you unless medically they can't do that. So your body is the best place for your baby to be. Your skin's going to warm up to keep them nice and warm, and your body's been preparing for this for the last 9 months. So your body is baby's natural habitat, and that's where they should go. Okay, there's a great short clip here, globalhealthmedia.org, and I'm just going to go there to show you how to get to where I'm going. I was having trouble with sound, so I'm just going to have you guys go and look there. So Global Health Media, you go under breastfeeding, and then for mothers breastfeeding in the first hours, this clip here. And I generally start this one about 1 minute and 14 in. So right about there where baby's delivered and on mom's chest. Okay, so I'll let you watch that to about 4 minutes. It's about 3.5 minutes, and it's about baby crawling to the breast. It's really amazing footage of baby knowing exactly what to do to crawl up to the breast and get latched and self-attach. So it's really neat little clip. Okay, so skin to skin, they call it the golden hour. They've done tons of research on skin to skin contact, and babies who are skin to skin with mom for 1 to 2 hours after birth, they cry less, they're more alert and responsive, their blood sugars are better, their skin temperature's better, they latch on well, and they breastfeed longer and more exclusively. So such a simple, low-tech thing for baby to be exactly where they need to be. The hormones, the oxytocin, that feel-good hormone, encourages baby to suck, and it also helps relieve pain and calm a stressed baby, and it sort of wakens baby's root instincts to be skin to skin. For mom, more oxytocin is released for you to calm you down and bring your blood pressure down and get rid of those stress hormones from the birth and start bonding and attaching with your beautiful little newborn. So right after birth, baby's in this quiet, alert state. It's really neat. They cry and then they settle in and they're listening and they're looking and they're probably trying to figure out what just happened. But they're wide awake, and there's imprinting and memory happening there. So it's a really nice time for them to just be alert and awake on your tummy. Your colostrum is ready for baby, and it's liquid gold. It's got lots of calories in it. There's antibodies in your colostrum. It has a laxative effect, so it gets baby pooping all that first meconium poop out, which helps with jaundice. But their tummies are very small. Their tummies, that's why the cherries are there. They're about the size of a cherry, and so they don't need a lot of colostrum, just drops. Okay, and whether you're choosing to breastfeed or not, skin to skin is really wonderful for both mom and for baby. Okay, so in those first hours after baby's born, they're going to do what's called an APGAR score. They do that at 1 minute and at 5 minutes, and a healthcare provider is going to do a brief assessment on your baby, and it quickly identifies whether the baby requires any special care. The assessment's based on 5 indicators. So they're looking at baby's heart rate, their breathing, their muscle tone, their reflexes, and their skin color, like their color, whether they're nice and pink or still quite blue. Each indicator is assigned a score of 0 to 2. So 10 is perfect. 0 means it's not so good. And anything over a 7 at the 5-minute APGAR means you've got a healthy baby. Baby's first test. Okay, after that, and they may do a blood cord sampling for RH, things like that. Baby gets 2 medications right at birth. Vitamin K, they're not born with enough vitamin K in this puts them at risk for bleeding. So babies are given an injection of vitamin K in their thigh, in their leg muscle, within 6 hours of birth to stimulate blood clotting. And so that's really important. Breastfeeding while they're doing this really helps with baby not even noticing they're getting the vitamin K. Erythromycin is an eye ointment. It's an antibiotic, and it's given to prevent infection just in case baby was exposed to harmful vaginal bacteria during birth, like chlamydia or gonorrhea. So both vitamin K and eye ointment can be given after that first hour, that golden hour of skin to skin of uninterrupted time together. They'll also weigh your baby. They're going to get a birth weight eventually within the first few hours. And I always encourage dad or grandma, whoever's in the room, to take a picture of baby on the scale so you can see the weight and have a memory for that, a picture. Mom gets up and showers, and while you're in the shower, they clean everything up, and then you can have something to eat because you're usually pretty hungry after all that hard work. As far as security goes, baby will have bands on their wrists and or ankle. 2 bands that match mom's numbers and then 1 more for blood work. And the support person also will get an identification band that matches mom's. So it's just a security measure. We always encourage you to never leave your baby in the room unattended. You're rooming in, so you're with them all the time, and you go with them for tests and things. So it's just an extra layer of security. As far as your bottom goes, right after the birth, during delivery, you might have had a tear to some of the perineal tissue in your bottom, or an incision called an episiotomy, sometimes to help baby out. So these often need stitches. Some smaller tears don't need stitches, but if they do need to do stitches right after they deliver the placenta, then they'll put some local freezing in your bottom and do some stitching. Excuse me. If you're told that you have a 3rd or 4th degree tear, then you'll be referred for some physiotherapy for after baby. So tears are described from 1 as the smallest degree to 4th degree, which is a more significant tear. So for 3rd and 4th, they should be referring you to physiotherapy. So if you haven't heard from anyone about that, then mention it before you go home, okay? Episiotomies, or that incision, they're made in about 1 in 8 deliveries. So look after your bottom. It probably will be a little bruised and swollen from the birth, not necessarily, but probably. So at first, for the first 24 hours, they'll have you use ice packs where they take a sanitary pad and they fill it with water and then they freeze it. So it's this disposable little ice pack. Feels really good on your bottom, keeps the swelling down. It melts, you throw it out, you get a new one. And you can continue to do that at home if you want to as well. Generally, though, after 24 hours, it feels really good to soak in a warm tub, just a small, shallow, short bath to help heal and soothe. Sometimes moms find that sitting on a rolled up towel in a ring or kneeling for a few minutes in the tub so they're not sitting right on the tub surface itself is helpful as well. Okay, and don't be afraid to take Tylenol or ibuprofen, naproxen if you need it to relieve the pain. Those stitches dissolve on their own if you have any stitches, and generally everything's healed by 6 weeks. Okay, so in postpartum, mom and baby will be cared for by the same nurse. You room in together, so you stay together. The average stays less than 2 days for a vaginal birth, and your partner or whoever your main support person that's with you is encouraged to stay to help with the care and to help you out in that day and a half before you go home. We've mentioned what to bring to the hospital, and that Mums and Kids sask.ca website or on the maternal services pages of the Saskatoon Health Region.ca website. It tells you what to bring to the hospital, gives you some good suggestions. Baby will have their first bath after 24 hours of age. So if you go home before 24 hours, your baby won't have had a bath yet. There will be lots of baths. But they're waiting for 24 hours just to make sure their temperature is nice and stable. You may get a package of self-administered medication, and that has a stool softener in it. It has some analgesic, some Tylenol in it. It has some naproxen and a multivitamin in it. And generally there's more than enough for your hospital stay, and so they send you home with that package, which is nice. It sort of lasts a few days longer. So keep taking a multivitamin and a stool softener as long as you need to, and Tylenol if you need it. Baby will get a heel poke after 24 hours of age as well. There's a little card with little circles that is a provincial test sent to Regina for genetic testing. They're looking for things like phenylketonuria and cystic fibrosis and about 30 things. You generally only hear back from that if something is positive, and even then it doesn't mean baby has it, it just means there'd be more follow-up. So generally you don't hear anything at all after that, but they will poke your baby's heel. And often while they're doing that, they will take some blood for bilirubin or to check jaundice as well. They'll check babies' jaundice levels either with a light meter on their chest and or a heel poke. And if baby's bilirubin is high as you're going home, then in Saskatoon, Healthy and Home will follow that up with you. In the hospital, there's open visiting hours, so people are encouraged to give parents lots of time to rest. Some parents don't tell anyone the baby's here until after they're home, just for that very reason, because you do want to get lots of rest while you're in the hospital. Mom will get fed, but dad has to fend for himself. So bring up some food for dad, or there are vending machines and cafeterias and things in the hospitals for dad to get some food. So rest, look after yourself, get sleep when baby's sleeping. There also will be a hearing test done depending on staffing, where they'll check your baby's hearing. And if that was missed, then they'll send you a letter to remind you to get that done to test baby's hearing. I mentioned in an earlier session just the birth registration package. You should see that package while you're at the hospital before you go home to get the paperwork that you need to register your baby's live birth and child tax credit and birth certificate if you're interested in that. So, okay, so spend that precious time in the hospital getting to know each other. It's teamwork, absolutely. Diapering and feeding and rocking and changing and just getting to know this little person. And then off you go home usually on the second day. So in hospital after baby, it's family-centered care. Everybody stays together in the family unit. The doctors will be around to see you daily, and usually their obstetrician discharges mom, and then a different doctor discharges baby, a family doctor. There are lactation consultants on the unit if you need help with breastfeeding. Nurses have generally had lots of education and experience around that as well, but the lactation consultants are there to help too. And then after you go home, baby clinics are where babies' immunizations get started at 2 months. So you'll have appointments at 2 and 4 and 6 months for babies' immunizations. Public Health also does flu shots. Once your baby's 6 months of age, they can get a flu shot. We talked earlier about tetanus, diphtheria, and whooping cough or pertussis. So make sure that mom will get one of those while she's pregnant, but make sure dad and grandparents and caregivers have had one as well. And then speech and language is also there to support you and follows your child right into school if there's issues at all. So generally, Public Health calls you within 3 weeks of being home just to see how things are going and send you lots of information at home. Healthy and Home, if you're in Saskatoon area, they will call you within a day or two of being home and just to decide the appropriate follow-up with you. So you're not on your own. There's lots of help and support out there for sure. Okay, so that's all I'm going to talk about in this session. We'll see you next time.